Good to have you along on a Tuesday morning. It's the 23rd of July. I'm Travis Justice. He's Ross Peterson. Justin Miller is with us. A couple of weeks ago, we went down a rabbit hole of Tommy John surgeries. We were talking about Paul Skeens. We were talking about, no-hitters in baseball and how, the last complete game no-hitter, who knows if we're going to see it because they're pulling pitchers, after 7 innings because of pitch counts and stuff like that. And Ross, you pulled up some numbers, I remember, of Tommy John surgeries in the 80s and 90s compared to where they're at now. And those numbers now are way up compared to where they used to be. And pitchers are on pitch counts. And we went through back in the day how, Nolan Ryan pitched, a 13-inning game and didn't think anything about it. So we thought, let's go down the rabbit hole of Tommy John surgeries. And if you're going to go down a rabbit hole, you bring in a doctor, you bring in an expert. Our good expert from the Des Moines Orthopaedic Centers. He's a friend of the show, been on a couple times before, Dr. Jason Sullivan. Good morning, Doc.
Hey, good morning, fellas. Thanks for having me.
Not a problem.
Absolutely,
You're
man.
always
Thanks for joining us again.
You got it. It's a pleasure with you guys.
So, do you do Tommy John surgeries, right? You do Tommy John surgeries?
I do. That's correct. Ironically, the Tommy John surgery was invented at the place I did fellowship out in L.A., the DMOS Orthopaedic Clinic. So Frank Jobe was the guy who helped establish that clinic, and he's the guy who was humble enough to name the procedure after the patient and not himself. So he called it the Tommy John procedure.
Wow. All right, so Dr. Sullivan, can you tell us just very quickly kind of what is the Tommy John surgery?
Yeah, so on the inside of the elbow, there's a ligament called the ulnar collateral ligament, and it has a couple bands, but the most important one is the anterior band. That's the band that usually tears. So when someone's, back in the late cocking phase and about to really, rip that ball, there's a lot of force on this really small ligament on the inside of the elbow. So essentially, if that tears or ruptures, you no longer have that stability, and so you lose your velocity, you lose your location, and all the things that are important to a pitcher. So to get that back, you have to basically anatomically restore that ligament, and you can do that by taking a tendon from somewhere else in the body and basically making the new ligament on the inside of the elbow.
Wow. What's the youngest person you've done Tommy John surgery on?
Well, that's a good question. So majority of people that need this procedure are overhead throwers, potentially wrestlers. But in Des Moines, there's a very active high school population of kids. And I've had some kids as simple as a four-wheeling accident, and they dislocate their elbow and tear that ligament. So, I would say usually it's, a 15 or 16-year-old who their growth plates are fused and they have an issue. You try, in high school kids, you really try not to focus on, my goodness, you need a Tommy John. There's a lot of other factors that you can correct and that kids can overcome. But as they get older and their growth plates mature, sometimes if they have a higher level of baseball in their future and they can't throw, that's when you start discussing, okay, you have this torn ligament. Is it worth the investment of 9 to 12 months recovery? To go through a surgery like that.
All right, so Doc, in your time of doing these, have you noticed any sort of pattern, or have you been able to develop any sort of, I don't want to call it cause, because otherwise you'd be really famous for that, but is there something that you've seen that's a common theme? Is it years of play? Is it position played? I'm really interested in the whole wrestling and aspect of this too, because I really thought this was a baseball injury. I didn't think of it being a wrestling injury.
Yeah, so I think that we know that competitive innings pitched is a factor. So simply throwing and long toss and things like that, when the juices aren't flowing, probably aren't as important as those maximal effort pitches. And so think back, today, how many guys pitch like Greg Maddux in the major leagues? How many guys are really picking their corners and throwing in the mid to high 80s and, have all sorts of different pitches and using it as kind of chess. It seems like it's changed where the hitters are so good that you can't let them make contact with the ball. So contact outs, like no one really wants a lot of contact outs. They want strikeouts, right? So I think there's an emphasis on that to some degree. And so these maximal effort pitches, specifically kind of slider and things like that, where the spin rate's up and everything, I think it's probably led to an increase. Everything is more, it's more, you're looking at your spin rate, you're looking at all these, things that you're trying to perfect. And so there's no room for the non-perfect pitch anymore. So I think that has a lot to do with it. And I think the younger you start, they may have something to do with it, right? So sometimes I think the best pitchers are, sometimes the best athletes, right? They play a bunch of different sports growing up. They maybe don't focus on purely baseball. And so some of the adaptive changes that happen in the arm, maybe they don't happen to these kids because they're the quarterbacks for the football team. So they don't have time to be throwing, during the fall. They're playing football, or, and maybe they're the star basketball player in the winter. So they potentially save a little bit of that for when it matters, and they're not burning the candle on both ends when they're 12 years old.
Wow. And that was one of the questions we had, because we went back to like the 80s and 90s, and I forget the number, but it was the number of Tommy John surgeries was a lot lower than it is today. You saw Nolan Ryan throw 13 innings, and the guy just never seemed to get hurt. So would you say kids that are playing year-round baseball are more susceptible to this now, and maybe the pitching styles have changed in the fact that you see a Paul Skeens who just wants to throw it by you at 104 miles an hour, and it's not a chess game anymore?
Yeah, I don't think that's hard to say that's sustainable, right? When you're throwing it by people in the 100-mile-per-hour range. And I tell everyone that comes to see me, in their youth, in their development, right, that, hey, you got to take 3 months off from throwing. I think it's very important. We actually know that, if you throw year-round, there's actually changes, structural changes that happen to the bones, like the upper part of the shoulder joint, that it actually changes in geometry to some extent due to prolonged throwing. So there's a lot of things in the shoulder that cause downward problems in the elbow. So a lot of people focus on, it's my elbow. It's actually not. It's a breakdown in the kinetic chain, like using the ground to throw, and your legs and your core and your shoulder. Those are all before the elbow, right? It's just the elbow that takes the brunt of it, and thus all the news in baseball.
All right,
icy
so the wrestling,
icy hot.
Yeah, right. And maybe we should start with that, Jason. When you, what would you recommend for? I know you're an orthopedic surgeon, but what do you recommend, or like when you talk to kids and they say, I get done throwing, what is the routine to kind of? Travis talks about putting icy hot on. There's some people that put ice on their shoulder or on their elbow or something. What do you recommend for a young kid?
Yeah, I think appropriate time of rest is very important. I think there's certain exercises and stretches you can do in the shoulder that are maintenance things that you need to do throughout the season. I tell some kids, when they're focused on, hey, I got to start throwing in November for the baseball season in May, I start questioning them, is that worth it? If we're hurting in March because we started throwing in November, is that worth it, right? And so, you add up all these things, and the last thing I like to do is a kid who's struggling with their shoulder or their elbow, I usually get them in front of a camera where there's some good places around town that can take snapshots of their throwing motion and kind of break it down, because there are some injury patterns of, how you throw, where your slot is and things like that matter. And so the more facts they can get and the more invested they can be in, you have to protect your arm like it's an asset if you're a good pitcher. And you just don't want to burn it while you're, a 7th or 8th grader or a freshman. You want to get to that next level.
Dr. Jason Sullivan from the DMOS Orthopaedic Center is joining us on the WCI Pools and Spas hotline. I am curious about this. When you go into surgery, how long does that surgery take? Is it an hour, 2 hour, 3 hour surgery?
Yeah, it's probably about an hour and a half, hour 15, something like that. It just depends upon. So usually what you do is you go down, you assess the old ligament. What people don't realize a lot of times with this surgery is there's a nerve that runs right next door to the ligament called the ulnar nerve, and a lot of pitchers have symptoms from that nerve. So it's sometimes hard to differentiate, is it the ligament or is it the nerve? And so if you're just focused on the ligament, you get down and you find the ligament and you assess it, and then what you need to do is you need a graft to restore that ligament. So there's some newer techniques where you can simply repair the ligament, but in most instances you're still doing what's called a reconstruction. So you take a tendon called the palmaris longus. It's a tendon actually if you take your thumb and your small finger and you push them together, sometimes you'll see a little a line pop up near your wrist. You'll feel a tendon there. and that is the palmaris longus, which is the most common ligament used to reconstruct the Tommy John. Otherwise, you can go down to the knee and take one little slip of the hamstring, and that works just as well. So it's a pretty delicate, it's a small real estate, really small area you're working in, and it's pretty delicate surgery. So it takes somewhere between an hour and a half.
All I realize is that
go ahead.
I'm not very smart, and I'm pretty dumb when it comes to this. The palmaris
Travis
longus.
and I looked like cavemen. As you were describing it, we're both touching our fingers to our thumbs going, nah, nah.
Hope we didn't cause any car crashes with people doing it on their That's how you see it, you know?
All right, and I know that this depends on patient and a lot of variables, but what's common recovery for a teenager that you have to do Tommy John surgery for?
Just depends upon, what the sport is. If it's baseball, it's still 9 to 12 months, I think, if you want to be safest. The ligament takes a long time to mature and get stronger and be resilient. So you're starting to throw way sooner than that, but it's basically you're kind of just adding layers of a little bit more of the throwing motion as you go. First 3 months, you're really just kind of protecting the graft, getting range of motion back in the elbow. The common misperception is, hey, they're going to come back and throw harder. That's not true. And if it is true, it's usually because they're working on everything around their elbow, like their shoulder and their core and their legs, and they've been stronger than they ever have. And so then they throw harder. But ultimately, it takes somewhere between, 9 to 12 months. If it's a different sport athlete, like let's call it a basketball player or a wrestler or whatever it is, it just depends upon the demands of the elbow. So you could get them back a little bit sooner in certain circumstances.
Excellent stuff. Dr. Jason Sullivan, always
Great.
appreciate the time, and let's get you back on again before football season.
I appreciate you guys having me. You have a great day.
Thanks,
Thanks,
Dr.
Doc.
Sullivan. Thanks, man. Always great to talk to you.